next thing we're talking about are adjustments, because that's what we do as chiropractors. That's how we can directly influence your health, okay? Now, traditional Western medicine, they're more reactive. I touched about this a minute ago. They're more reactive. When something happens, they give you a pill, a potion, or a lotion to take care of it. And if that doesn't work, what do they want to do? They want to cut on you, right? They want to cut you open and put something inside you, or they want to cut you open and take something out, okay? Now, chiropractic, as well as a lot of Eastern medicine, non-allopathic stuff, we're more about prevention, drug-free, natural approach. As chiropractors, we don't give drugs, we don't do surgery, we allow the body to heal itself. Who here knows that your body can heal itself? Okay, when you were a little kid, you fell down and got a cut on your finger, and your mom put a Band-Aid on it, right? Did the Band-Aid heal the cut? No, it just protected it, right? Same thing if you broke your arm. You fell out of a tree and broke your arm. Did the fracture heal because you had a cast on it? No, it just protected it. Your body healed from the inside out. That's one of the main principles of chiropractic, is that the body is a self-healing organism, okay? But look at this, drugs. Are drugs safe? Some people are saying apparently not. Well, you didn't know this. 1,500 drugs are taken off the market every year. Every year, 1,500 drugs are taken off the market. 5% of all acute hospital visits are people that have, prescribed drugs. They go in there because they took a drug that their doctor and the pharmacist gave them, and it has a bad reaction. Okay. Has anybody ever had an allergic reaction to a medication that they had, and they broke out in hives, and they had to go get shots and stuff like that? It happens all the time. But drugs inherently are not safe. It's a chemical. And the chemicals that we put inside of our body all the time, they're man-made, so that they're not supposed to be inside you. God gave us everything that we needed to heal ourselves. It's just whether or not you can heal at your potential. Okay, and they're doing great. I'm not trying to knock medicine or anything. They shine at emergency medicine. If I leave here and I'm on the way to the office, I get an accident, my arm gets ripped off. I'm not going to call Dr. Brodas and say, come adjust me, okay? I want them to take me and shoot me up with morphine and do everything they can, sew my arm back on. But that's where they shine. But some of we're sick. We're a sick country. We spend more money than 3 different countries' gross national products put together on healthcare. But yet we rank 29 in health overall in all the countries in the world. So we're pretty sad in that. Our mortality rate for infants, we're number 13 in the world. Number 13. So you're safer going to other countries to have a baby, right? So it's crazy. We spend so much money on healthcare. Most of it is about diagnosis, not about treating or preventing. It's about finding out what's wrong with you. Okay. Drugs are effective. Well, before a drug can be effective, you have to have what first? The right diagnosis. Okay, so what they did was they took the best doctors in all the land, Harvard Medical School, right? They took 1,000 patients that were in their clinics, and they took 1,000 patients that were terminally ill, right? And they diagnosed them. Well, when these patients passed away, they did autopsies to find out what the cause of death was. And guess what? They were wrong 50% of the time. So right off the bat, you have a 50-50 chance of whether or not you have the right diagnosis. And then you have to have the right chemical working in your body at the right time in the right amount to get the desired effect. Have you guys ever been on a medication that didn't work? And then you go back to the doctor and they give you another medication that may or may not work, or they change the dosage. It takes a long time, right? It's because it's not something that we're used to, or our bodies aren't used to. Antidepressants are commonly prescribed to relieve low back pain. And they don't actually relieve the pain at all. It just make you more depressed and you don't feel it. You're numb. Well, pain is an indicator that something is going on. It's like your smoke detector at nighttime. 2 o'clock in the morning, your smoke detector gets off. You're going to run over there, house full of smoke, and pull it off the wall and take the batteries out and go lay back down? No, that's a symptom. It's telling you something's wrong, okay? So why would we want to take something to get rid of pain to let us know that there's a problem going on, but we don't want to take care of it? It's like putting a piece of tape over your oil light in your car, right? Who wants to drive from here to Corpus doing that? Nobody, right? Because you want to get stuck in Austin traffic and downtown Austin stuck with your car like that. So it's important to make sure you take these. You got to listen to your bodies. And patients tell us all the time, "Well, how do I know this is wrong?" You got to listen to your body. You're better to listen to your body than I am. It's just that you need to make sure your eyes and your ears are open. Okay. Now, what about surgery? Is surgery safe? Sometimes even routine surgeries can have problems, right? But inherently you want that to be your last option, okay? But in California back in 2002, the HMOs and the surgeons were battling, saying, we pay you too much money. And the surgeon said, you don't pay us enough money. Can you imagine that? And so anyway, what they did was the surgeons went on strike. They said, we're not going to do any elective procedures only. We're only going to do life-saving procedures. So that was in February of 2002. What happened was the death rate in Orange County, California went from 11% down to 7%. Okay? And after that 30-day time period when the dispute was resolved, it went up to 12%. The next month it went to 14%, and it leveled off at 13% for the next 2 years. So inherently, surgery is not safe. We had a patient that was in our office a year ago, Thanksgiving, and 2 days before Thanksgiving was having gallbladder surgery, where they go in with the 4 little holes. They said he was going to be out the next, that night, go home. I don't know if anybody else has ever had that, but he didn't leave the hospital till March because he got an infection. Then he had complications from the infections. Then they had to go in and do surgery to clean him up. And when they did that, something else happened. And so he spent 4.5 months in the hospital for a routine surgery. So inherently things can go wrong. And so it always wants to be your last option, okay? Effective, yeah. 85% of people that have neck surgery for pain, 10 years down the road, have problems again. So what did it really fix?